How to get rid of a rash under breasts. A breast rash is the irritation and redness that usually occurs on the skin under the breasts. Breast rash may occur as a result of wearing a bra that doesn't fit well or excessive sweating below the breasts. A breast rash may present itself in the form of scaling of the skin under the breasts, blisters, itchiness, and red patches. Thankfully, there are many things you can do to soothe the itchiness and get rid of the rash. Method 1. Treating a rash at home. Number 1. Apply a cold compress to the area. If you notice a rash on your breasts, try a cold compress. This can help reduce inflammation and lead to an improvement in symptoms. You can simply wrap ice in a cotton towel or plastic bag. You can also purchase ice packs from a local supermarket. Keep in mind store-bought ice packs should not be applied directly to the skin. Wrap them in a towel before applying. Apply the ice pack for 10 minutes at a time. Then, take a break and repeat as symptoms persist. You can also use a bag of frozen corn or peas as an ice pack. Number 2. Take a warm bath or shower. A warm bath or shower can help with any skin rash, including one under the breasts. You can also run a washcloth under warm water and place it under your breast for a few minutes. Number 3. Try basil. Basil is an herb that may help soothe skin for some. Crush fresh basil until they form a paste-like substance. Then spread the paste gently onto your rash and let sit until dry. Rinse the paste off with warm water and pat the area dry. Use this method once a day and see if you notice an effect. Once again, home remedies do not work for everyone. If you notice this worsens your rash, do not repeat this method. You should not use basil leaves if you know you have an existing allergy to basil. Number 4. Apply calamine lotion, aloe vera, or a fragrance-free moisturizer to the rash to soothe irritation. Certain lotions and moisturizers might help alleviate a rash. Try using a fragrance-free moisturizer, aloe vera, or calamine lotion. Calamine lotion can prevent itching and irritation, especially if you believe your rash was caused by something like poison oak or ivy. Use twice a day and apply with a cotton ball. Aloe vera gel is a gel sold at most supermarkets and drug stores. For some, it provides relief to rashes and skin irritation. It has antifungal and antibacterial properties that can help a rash heal. Apply aloe vera gel to the affected area. You do not need to wipe it off, but you should let it sit for about 20 minutes before getting dressed. Repeat as needed. You can buy a fragrance-free moisturizer at a local drugstore or supermarket. Make sure it is unscented, as the oils and perfumes used in scented lotions can make irritation worse. Apply to the rash as needed, following any specific instructions on the bottle. Number 5. Use tea tree oil. For some, tea tree oil can soothe skin rashes. Tea tree oil has excellent antimicrobial properties. Keep in mind tea tree oil should never be applied directly to the skin, as this can make problems worse. Always dilute tea tree oil in olive oil before use. Mix 4 tablespoons of olive oil with 6 drops of tea tree oil. Dip a cotton ball in the mixture and dab it gently on the affected area. Massage the affected area lightly for a few minutes to work the oil into your skin. For best results, do this after taking a bath or shower and again before going to bed. Some people may have sensitivities to tea tree oil. If you've never used it before, test it on a small area, like the inner part of your arm, to make sure it doesn't irritate your skin. If you notice any irritation, or if your symptoms get worse in response to tea tree oil, cease use immediately. Method 2. Seeking medical care. Number 1. Know when you should see a doctor. Most rashes under your breast are benign and caused by common skin conditions that will go away without medical treatment. However, a breast rash can occasionally be a symptom of bigger medical concerns, such as shingles. You should see a doctor under any of the following conditions. If your rash does not respond to at-home treatment after a week or two, you should see a doctor. You should also see a doctor if your rash is accompanied by symptoms like a fever, severe pain, sores that won't heal, and worsening of symptoms. Number 2. Go in for a doctor's visit. Make an appointment with your regular doctor to have the rash evaluated. Let them know if you are experiencing any other symptoms in addition to the rash. Your doctor will probably want to look at the rash. If it's caused by something benign and you don't have other symptoms, they may be able to diagnose you without further examination. A skin scraping test may be ordered to check for a fungal infection. The doctor may also use a special lamp, known as a Wood's lamp, to examine the skin further. In rare cases, a skin biopsy may be needed. Number 3. Try medications. If the rash is caused by an infection or does not clear up on its own, your doctor may recommend medications. There are a variety of prescription meds used to treat skin rashes. Antibiotic or antifungal cream may be recommended, which you apply to the skin as directed by your doctor. Low-dose steroid cream and creams that protect the skin may also be suggested. A topical antibiotic may also be recommended if the doctor thinks you may have a bacterial infection. Method 3. Making lifestyle changes. Number 1. Keep the underside of your breasts dry. Moisture under the breasts can lead to skin infections and rashes. 14. Work to keep the underside of your breasts dry to prevent rashes. Clean and dry the skin under your breast after workouts. Make sure to dry underneath your breasts on occasion on hot days when you are sweating a lot. Consider using powder or cornmeal to keep the area dry. You may want to use a fan to dry under your breasts. Number 2. Watch out for potential irritants. It's possible a certain product you're using may be contributing to a skin rash. If you've been using a new soap, shampoo, lotion, fabric detergent, or other product that has contact with your skin, cease use. See if symptoms clear up. If they do, avoid that product in the future. Number 3. Wear a bra that fits you well. A bra that's too big or too small could contribute to skin irritation that causes rashes on the breast. Buy bras made out of cotton that use high-grade elastic materials. You should not buy bras made out of synthetic fabrics, as these can irritate the skin. If you're unsure of your bra size, go to your local department store and ask for a fitting. Avoid underwires if possible, or make sure they aren't poking or irritating your skin. Number 4. Switch to cotton fabric. Cotton fabrics can help reduce moisture under the breasts. It's more breathable than other fabrics options and more readily absorbs moisture. Aim for clothing made out of 100% cotton fabrics. Thanks for watching.